Good evening. My name is Dr. Sayed, and I'm one of the consultants in the general surgery clinic. Um, how are you doing today? Okay, going through your file, I can understand that you were admitted in this hospital with some issues in your gut. Okay, let me understand how are you doing today after 1 week of discharge? Okay, I'm really sorry to hear that. My due apology that it happened with you. Normally, it is not a norm of our center to discharge the patient without complete information regarding his diagnosis and future prospects. Uh, Please accept my apology. Uh, but now, going through the your file, let me make you understand that the good thing is that the hospital reports which were done at that moment shows that you didn't had any perforation or abscess or peritonitis itself. Uh, Rest assured that whatever have been done, you are in safe hands. Um, you are having diverticulitis, and diverticulitis is basically inflammation of the diverticula, which is outpouching of the gut or the colon or the large intestine. The good thing is there is no perforation at this moment, but yes, regarding your question that can it happen again, I should be very clear to you that it can happen again if you don't follow the recommendations. And for recommendations, you have to continue with the medications and have a dietary modification to avoid constipation. That is very important. For that, you have to have high intake of liquids, and sometimes episodic purgatives can be used. But don't let yourself being adapt. Don't let adopt yourself to the purgatives itself. Oh, I understand that you are worried that why antibiotics were advised at that time and why they were stopped. Let me make you understand. Diverticular disease can also happen with bacterial infections. And infection can also happen with diverticular diseases. So, to avoid infection, you were given antibiotics, but you don't need any antibiotic at that time, at this moment. You just need the recommendation which I have told you already. Yes, I can understand that you are very concerned. Let me make you understand. We are here to help you out in any way. If you have any concerns, you can come up to the clinics without any referrals. The other thing is, as you told me regarding your issues, let me make you understand that you are in a good position. You didn't had any perforation at that time. There was no inflammation, and it is everything has subsided. I know you are concerned that you were admitted in the hospital, and rather, if I was admitted in the hospital, I would be also concerned for myself. But rest assured that your situation is now in a good, in has been dealt in a good way. Uh, if it happens again, your question, if it happens again and there is rectal bleeding again, or abdominal pain persists, we can do a surveillance colonoscopy. But this is not needed at this moment. Uh, I'm pretty hopeful that with a person like you who is taking care of our health, I am sure that you will go through these difficult times